We're here at the end of the day here at OAA, and we just figured we'd just kind of riff about our days today and what was a typical day in the office. So, Mike, you were in the office all day today.
I was. Full day, as usual.
God bless you.
Yeah.
So, hey, what kind of stuff were you seeing today?
See a lot of osteoarthritis, but had an interesting case. A lady, been seeing for a while. She has knee arthritis in her 50s, pretty fit lady, runner. She got a new rescue dog, and it was a little hyper, and it came in last night, hit the side of her knee buckled in, had swelling afterwards. Trouble walking now.
Right.
So, she's got the knee arthritis, which isn't horrible, but she unfortunately sustained a grade 3 MCL injury.
Oh, really?
Yeah, so,
okay.
But she should do fine. We'll get an MRI to make sure her meniscus looks okay. But I've seen that quite a bit. Dogs coming in, taking out the knees.
It happens a lot.
Yeah, I know.
It happens a lot, more than people think.
Yeah.
One of the things about medial ligament sprains, especially in somebody who is having a lot of arthritis, one of the things you have to worry about is if they have a real bow leg, and you injure that medial ligament, which is on the inside of the knee, all of a sudden they get extra instability because they already have some of that pseudo-laxity there.
Exactly.
So if it is grade 3, what's your plan?
My plan right now, we put her in a T-scope, and she sort of is figuring out
Which is a long brace.
Yeah, long brace. I mean, she came in saying the only way she can walk around is keeping her legs straight.
Okay.
She's pretty smart, right?
Okay. She
locked
it.
Yep. So we gave her a brace to lock that, keep her legs straight. And we'll keep her there for 2 weeks. So get an MRI, make sure she doesn't have any other damage in the knee.
Right.
If she's doing well, we'll start giving her some gradual range of motion. In the meantime, she's to work on isometric quad strengthening.
Right.
So quad strengthening, not bending the knee, just with her.
Correct. So straight leg stuff.
And then probably progress her into some physical therapy,
Right.
and she'll probably end up doing fine.
What do you think about the future of that knee? You think it's just gonna? You think this will add to it, or is this just something that she'll get over, and then it'll just be the natural history?
I think
of the
she'll get
arthritis?
over it. I mean, she's, I think one of the big things we'll see is whether she has a bone contusion in there, which she
Right.
could.
Right.
That may,
especially that age.
Right.
You worry about a little osteopenia, osteoporosis.
Right.
Yeah.
So, and then we'll look at her vitamin D levels and stuff like that if she
Exactly
does that.
right.
But, that may potentially accelerate things if she has a little bit of bone contusion in there. But her knee's got good alignment as is.
Oh,
and
good.
like I said, she's pretty fit. She's been stopped running. She finally realized she had to stop. And
Right.
but she's been cross-training with other things. So I think she'll do okay.
Speaking as a runner,
Yes.
I mean, not me, you. Speaking
You tried, right?
I didn't try very hard. My distance was a 20-yard dash.
Yeah.
As somebody who obviously ran through college and was a runner all through your really adulthood, and now that things are getting a little, you're being a little reasonable at this point.
Yeah.
I understand you got a new purchase.
Yes. Yeah, so I love running.
Right.
I love being able to go home, throw on a pair of sneakers, and go out the door. And that's
Right.
what that patient I told you about, we had that discussion too.
Right.
Now I got to potentially, now I'm bringing in equipment. So
Right.
I did happen to buy an elliptico
Right.
on the
Love
recommendations of Dr. Palumbo. And I just got it recently. I've been out once or twice with it. It's been a little cold, so I'm looking to get an indoor trainer and use it as a
Although
indoor.
I'll tell you, I mean, for those of you who don't know, an elliptical is it's basically upright and it has gears on it, has front and back brakes, and you, instead of pedaling, you're standing upright and you're using your feet to go back and forth, just like an elliptical machine. And what I like about it is you're riding high. You're up. It's not like you're leaning over on a bike. You're actually up. You feel like you're moving. And you could do 10, 15 miles without a problem on it, and really get a good workout, especially on the rails trails. I try to stay off the real road, but the rails trails, and you get warm pretty quick.
Now,
So,
it kicks your butt.
Yeah, it does.
When
So,
you first start.
and obviously one of the reasons why you did it is because it's low impact.
Yes.
And it's one of those really good things that you can still get out.
Yep.
You go distances. You can go on a kind of a tour and still feel like you're getting a workout.
Yeah, absolutely. Unfortunately, because of here's another sidebar, because people ask me, are you still running? And I'm like, no. And they're like, is it your knees? No, it's not my knees. It's actually my back. But common misconception that running predisposes you to knee osteoarthritis. It does not. Plenty of studies showing that. And actually, I was waiting for this study. A study came out a couple of years ago looking at people with underlying knee osteoarthritis who did what's called symptomatic running. So that's where if they had a good day, they went out and ran.
Right.
If they had a bad day, they didn't run, and there was no progression of the osteoarthritis based on control. So you can run with knee osteoarthritis. I always say there are people that are built to run.
And there are those who are not.
If you're not built to run, you probably shouldn't be running with knee arthritis.
The last time I ran over 2 miles was my last 2-mile run in college, I think. Other than that, I played a lot of basketball. I ran a lot, but I just don't like running.
Yeah,
it was like one of those things.
I hear that a lot, and particularly in football players.
I don't like it. I was a good sprinter, so real interesting, and I appreciate for those of you who are out there and you are dealing with some arthritis. Obviously you don't want to add to the burden. When you're heavy. You put a lot more weight. You could multiply your weight by 4 of what goes through the knee every step you take. So that's kind of important. So obviously, the first thing we talk to a lot of our patients about is losing some weight.
Yes,
trying to get that down as much as possible, and then being realistic. Listen, if you have terrible grade 4 arthritis. It's like having a headache and smacking your head against the wall. I mean, on the other hand, you can't do any more damage. So, you get these, it seems like the ex-Marines are crazy. So, but we do have some of those. So, all right, so get out there, and no matter what, we got to keep active. That's the key. Keep moving, keep active. So, all right, man, we'll see you next time.
All right.
All right. Bye-bye.